surgery is not always the only option. There are different things that we can do. As a surgeon myself, I've seen the ability of what a surgery can do, how it changed life, how it can actually really change the people move and how the movement of the body. I'm Professor Paul Lee, ACL and cartilage surgeon. So why do we always have to have surgery? You may see some surgeons, you may see some doctors to say that you have to have surgery. Is that always the case? Of course, there are some times that when a joint is damaged beyond repair, we need to think about treating it as a whole body. So at that point, we want to replace the joint. However, there are much more modern techniques that we can have, and nowadays technology have moved on. Other enabling technology such as cells technology, growth factor technologies, and also different injections that we can give it to the body, allow our body to regenerate. As a regenerative doctor, I know and I understand the biology and how we should use injection to treat people. But at the same time, I'm a surgeon. If need be, we need to go ahead and correct things and replace things. There's no one answer to fit everybody. So traditionally, when we talk about does someone actually need surgery or not, I think it always depends on what the condition is. And a lot of the time when I see a patient that they came and see me for second or the third opinion because the other surgeon or the other doctors told them they need surgery. And actually, when we look at what is the root cause of the problem, and when we actually look at the scan, when we actually see the images, everything changes. Because a lot of the time, people do not look at the actual scan itself. In medicine, we actually look at a report of a scan. I have the advantage when I see my patients that you will have told me the symptom, I will have examined and find out what the problem is. Then I look at the scan so I can correlate what the problem is that you have to the scan to actually make things a lot more logical sense. And a lot of time, by linking those two together, you actually don't need to have surgery because the problem is elsewhere, can be treated differently. I would like you to take a pause to have a think, is this logical? The surgery that I'm about to have, is it sensible? Does it actually make sense? Do I actually really understand it? If not, ask the question. I am Professor Paul Lee. Stay young, be strong, live forever. Subscribe to my channel. See you in the next episode.